In a renewed push for industrial harmony, federal government has met with leaders of health sector unions and associations to advance reconciliation efforts aimed at sustaining peace and stability in the nation's healthcare system. The meeting, led by the Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, underscored the administration's commitment to improving welfare of health workers.
We will work together, respect one another, resolve to the best extent possible many of the long-standing issues, some of which are 20 years in the making, but we'll work towards them in a constructive manner so that we continue to enjoy the peace that we have seen under this administration led by President Bala Audu, and that we would like to establish peace based on justice and fairness. And some of the immediate items, for instance, the outstanding arrears, that is a common issue for commerce and conheads. We do have it on good grounds that the Honourable Minister of Finance and the Coordinating Minister of the Economy has pledged to pay those arrears before the end of August, and we will continue to work with him despite the difficulties of that position to ensure that we get those payments started.
He noted that reforms implemented over the past 2 years have significantly enhanced service delivery, attracting patients from West Africa, Europe, and the United States. He also emphasized that the development reflects growing confidence in country's healthcare system and underscores need to consolidate the gains through sustained investment, policy continuity, and dedication of health workers nationwide.
There are policy and establishment issues that have been raised by the various unions. Those from the Ministry of Health, we will start implementing those actions, and when we take stock at the end of August, I'm sure you will confirm that at least some of those we have been able to implement, and others that will take longer, you will see us making actions to see that we resolve them. We are already seeing people from West Africa coming to Nigeria for medical tourism. We're seeing people from the United States and the United Kingdom coming to visit our hospitals. It's thanks to the amazing health workforce that we have, members of the HESU, NAM, NMA, the professionals, private, public facilities that are providing services, and our public hospitals. That is already happening. But that can only be sustained if we lean in a constructive manner. And that is the spirit that I believe we have made today. And the various agreements that have been signed between us, we will, in good faith, do our best. And we hope that the issues of ultimatums and strikes, when you go back to your members, you convince them of the good faith of the government, and that they will see reason to ensure that their leadership are empowered to rescind many of those issues. And thank you once again for the collaboration. Thank you very much.
President, Nigerian Medical Association, Professor Bala Audu, affirmed the signed memoranda of understanding and expressed hope the agreement would usher in lasting industrial harmony, improve working conditions for health professionals, and ultimately enhance quality of healthcare delivery across the country.
It's a debriefing meeting after we have all signed MOUs. The Nigerian Medical Association, the Joint Union of Health, the Joint Health Union, as well as the Nigerian Association of Nurses and Midwives. We've all had MOUs with the Federal Ministry of Health and other related government agencies. We've all signed, we've all agreed to the point of implementation. Of course, there are some areas that remain contentious, which which we have in principle agreed should be addressed through a joint CBA, so that there are no individual CBAs that may be conflicting with each other. So those contentious issues, we believe, will soon also be called for a joint CBA agreement, while those ones that are not contentious, all we are waiting for is implementation, as has been clearly made by the coordinating Minister of Health and Social Welfare, that will see implementation taking place immediately, because the President of the Federal Republic of Nigeria, President Bala Audu, GCFR, has already given full permission for the implementation of those aspects.
To ensure smooth implementation of the agreement, an inter-ministerial committee chaired by the Minister of State for Health and Social Welfare, Dr. Isaac Salako, has been inaugurated. Members include representatives from the Ministries of Labour, Finance, the Office of the Accountant General of the Federation, and other relevant agencies.